Hey, everybody. Good morning or good afternoon, depending on the time zone that you're joining us from. Happy that you're all here and able to jump in to this first ever Bright Start Tennessee Network Lunch and Learn that we're going to have. This is an exciting time for us at TQEE, and we're going to jump right in and cover some great information that we hope will be very useful for you in your work in your communities. It's good to see all of you and your faces, the panelists, and hopefully those that watching at home or later on are going to be able to enjoy this time as well. So for those of you that don't know, Tennesseans for Quality Early Education is a nonpartisan coalition of advocates focused on Tennessee's youngest learners. We really want to advance state policies and practices that ensure that all of Tennessee children from birth through third grade get the high quality care and education that they need to power our state's future. Through that, we've started up the Bright Start Tennessee Network, which all of you are a part of. You all know this, but we're a statewide network of community partnerships, really focused on closing achievement and opportunity gaps for children birth through third grade. We are across the state. For those of you on this, watching this webinar, you are probably part of one of our communities or regions across the state, represents 49.3% of the population of Tennessee. And we're excited to have you here specifically to learn a little bit about evidence-based home visiting and enrollment and retention practices within that. You'll know that we have created this cycle of success. We know to get to third grade reading and math proficiency that we really need these three things: high quality birth through age 8 learning environments, physical health, mental health, and development being on track beginning at birth, and then supported and supportive families and communities. From within that, we've got a breakdown of 15 measures of success. This is our framework. You all have seen this, you know this, you're living this by now as you've been making your plans. The exciting thing about this is when we talk about the Lunch and Learn, what we wanted to do is take specific practices that you all have implemented or are starting to implement and really take a problem or practice within that and then address it specifically through innovative solutions. And we wanted to highlight both state level people that can talk to us about this, but we also wanted to specifically look at individual communities and highlight some of the work that's going on. We know that of these 15 measures of success, the exciting thing is that evidence-based home visiting as a model covers 11 of these. So this is a highly important and strategic strategy that we have promoted within our clearinghouse and that you all are implementing as we go. So excited to kind of be here and to cover this. We've got a great set of panelists that are going to be here and discussing things with us, and excited to have each of you get to know these folks just briefly as we kind of dive in to their specific area of expertise. I'm going to highlight real quick. I'm going to go back into my PowerPoint just so that I've got my slide here with all of your information up today. All right. I'm going to remove my spotlight off myself here, but so you can see here, we've got a wide range of people. So we got Lynette Hicks is going to be joining us with the evidence-based home visiting. She's the director there at the Department of Health. Christel Crawford is in Knoxville with the program manager for parents as teachers, Knox County Health Department. Jennifer Vaida is the Chief Strategy Officer for Nurture the Next in Nashville area. Becky Carroll is coming to us from Memphis. She's the Clinical Manager of Methodist Le Bonheur Community Outreach. Sarah Beth Wynn is going to talk to us a little bit about a specific training program that they've got going on, Consilience Group. She's the portfolio manager there. Then Sandra Allen is going to speak to us. She's the Senior Advisor of Porter Leith's Early Success Coalition and is going to talk to us a little bit about the Tennessee Early Connect project as well. Later on, if we have time and she's able to join us, Kristen Dunn is going to give us an update. Her name's on there twice. She's going to give us an update on the early infant and early childhood mental health consultation hotline, or the warm line, I should say, that's coming up that will be announced soon. So yeah, what I'm going to do now is stop sharing my screen. Here's our panelist. This is going to be kind of covered through, the way that I'm planning on kind of holding this as a Q&A to talk to them about this. We know what home visiting is. We know that it's a something that truly connects parents with trained professionals to really provide in-home support, both during pregnancy, but then also kind of through that first 5 years of a child's life. And the programs, they offer a range of services to families, including parenting and health education, child abuse prevention, and early intervention. And the goal of each of the specific programs, depending on your model, may differ, but generally speaking, we know that these programs aim to provide improve child and family well-being. And so I'm excited to jump in and talk about this, because one of the things that we know is this is a critical thing for families across the state. But one of the things that we struggle with is making sure that we get enrollment rates where they need to be. And then sometimes once we get those families there, how do we make sure that we're retaining those families and keeping those families? So enough from me talking. I'm now going to kick it to Lynette. Let's ask you the first question here. Give us a little bit of an overview, if you will, from the state perspective, what you're seeing in regards to enrollment and retention. If you want to give us a little overview of what you see from the state, that would be fantastic.
Thank you, Jonathan. Of course, Jonathan just gave an overview as well of our maternal and infant early child home visiting program, or MACV as we call it. And some of the goals or overviews definitely to improve maternal health and abuse and neglect, and encouraging positive parenting, and promoting child development and school readiness, and thus encompassing all three of our models that he just mentioned as well. And just some goals and objectives for us regarding retention and enrollment. During our 22-23 report to HRSA, our funder, we had a total of 1,034 families that were served with MACV funds through this grant of performance specifically. And this includes 651 new families, and continuing families, it was 383. Therefore, the capacity of the program was about 94%. And that remained above the expected 85% of capacity for the sites. And then the median retention months of this period was 21.14 months, which was almost 2 years. And note that these newly enrolled families that are still receiving services, they're less than 12 months, are not included in the calculated median, as our data people would tell us. And also, just to let you know, I added a little bit, also talked about we couldn't serve our families if we didn't have the capacity. So our workforce, and we're continually trying to increase our workforce to make sure that they're there to serve the families. And we're doing this through the call center, through the innovation grant. Now you'll hear Sandra Allen and her team talk about partnerships and collaborations with a lot of you, CQI projects that we're doing to increase staff engagement and retention, a community of practice for supervisors, not to mention our Home Visiting Leadership Alliance teams that we're now forming through common language, new member orientation, and staff retention. So those are just a few of the things. And as of through our legislative report, and I believe that's available for you all to review on our website, again, a total, and the time periods are different. Let me just clarify. Sometimes when we're reporting to our federal officers, that's on a federal fiscal year, as opposed to the state report that's on the state fiscal year, which is different. So in totality, there were 2,000, including all of our funded sources, 2,899 children and families that received services. And that was, again, the timeframe July 1, 2021 to June 30th, 2022. And as you all know, we're now in all 95 counties and being served. And we have what we call priority populations that the sites serve, which includes low-income women, low-income families, pregnant women younger than 21, history of child abuse and neglect, history of substance abuse, users of tobacco products, children with developmental delays. And so families that include individuals who received or formerly served in the armed forces as well. So that's just a few of the highlights that we want to give you from the state perspective for you be able to see that. And now I believe I'll turn it back over to Jonathan so he can introduce the specific sites to talk to you. Thank you. Jonathan, you're on mute.
3 years. We've been doing this 3 years. You'd think I know, right? Thank you so much, Lynette, for both the advice on the unmuting and also for the overview. It's really good to see from a state perspective kind of what the goals are with that. I don't think the slides progressed through that, but we're happy to send those out as well afterwards. But want to kind of turn now and look at the 3 models within the state of Tennessee that are evidence-based home visiting models that focus specifically on this retention and enrollment issue. Turn first to Christel Crawford, who's in Knox County with Parents as Teachers. She has been doing this for over 7 years now and has been kind of in this world and has seen the highs and lows of in and out of the pandemic, and really want to turn to her to kind of talk to her about specifically the Parents as Teachers model. How are you guys addressing and tackling enrollment and retention issues?
Thanks, Jonathan. Yeah, mentioning COVID, that's definitely a thing, right? That's kind of where my story starts with this, because that's when we were starting to see the issues with numbers. And so 2020, March it hits, right? February, right before that, I became the lead parent educator, and then we went home. Then we're learning Zoom, and nobody knows what Zoom is, right? So we need to learn how to work with the families, teach them Zoom, and do a whole new thing. So that's kind of where it all started for us. And in that time, we also started receiving state referrals, and those were cold calls. So that was our challenge, right? We were wanting to increase the numbers of people that answered the phone and that said yes, because we wanted them to know about this wonderful program. So it was a CQI project. It's kind of where it started. We just saw we had to be very intentional, right? I mean, it went from all the way to a welcome packet that had the Parents as Teachers group with their smiling faces, and very intentional about what we said in the letter, because we knew they would be receiving a lot of junk mail. We wanted them to open it, and then we also were intentional about how we when we sent it. So we would send the letter or the welcome packet, and then we would time the time when we would call them, because we wanted them. The idea is, they're going to open the packet. They're going to see all the cool stuff in it. It's got a little book, a little parent-child activity, and they're going to want to answer the phone, right? So that's kind of how we started it. We did that project. We went over the course of the year, and we actually increased our rate by 50% of answering. And that's kind of where it started. We've actually implemented that now with regard to all of the other referrals that are coming through, because what we found was what works is if one person is calling them, right? Because that one person has a specific way of talking to them. I always call it, you guys will probably laugh, but selling the program, because we want them to know what this program has to offer their family. So that's kind of where it all started. But then, of course, you're in the middle of COVID. Then fast forward, our beloved manager left, and that was in 2021 of June. And so then she'd been here for a long time. And then I step into that role, and I look at, okay, we need to increase numbers, but I need people to know who I am, right? They don't know who I am, and I don't know who they are. So I started with our partnerships that we had, and I started meeting them. Let's meet, let's talk to me about what you do. Tell them what we do. How can we work with each other? How can we support each other and reach the families in Knox County? Because that's really what it's all about, right? So I did that. Then I branched out, and I started reaching people I didn't know, partnerships that I didn't know. And I honestly, guys, I could not have even predicted how this would work, because what's happened is that these partnerships have increased our referrals. They are helping the families, right? Because the families are receiving things that, maybe they're going to places like they would have never gone. Like we have anybody who's in the Parents as Teachers program gets a Muse membership here in Knox County. Well, that's something that's a benefit. So there's so many things. It just kind of the way it works. So, I mean, that was huge, but it's not just that. So then when I think about the other pieces, it's families. It's all in how we're interacting with these families each time that we're interacting. Do the parents feel heard? So I looked at that and I said, there's only really one time a year they can respond to say if they're happy or not. So we implemented some quarterly surveys because I wanted to hear from them. And I wanted them to be able to, to let me know it's a parent-led program. What do you like? What are your suggestions? Do you have any feedback? Then the next piece was, of course, the parent educators. That's a piece that's huge. They're the boots on the ground, right? If they're not happy, but if they're not feeling supported, then that's going to translate into how they interact with their families. So that's the piece. And I'll tell you what I learned. What I learned is it's all about relationships. That's what this is, relationships, because that's how honestly, that's how we increased referrals. And just the results, we are at 98% capacity. We have warm referrals, services for families. So that's how we did it.
That's fantastic. When we talked kind of the ideas around setting this webinar up and this thing, I know one of the things we talked about is most of the people working in this field are trained in some sort of background in social work or something related to families. And it's like at some level, you still have to learn how to market yourself, right? You have to learn how to sell this program almost as a sales background to communities to make sure that they buy in. So, well, congratulations on the 98%. That's fantastic. Appreciate the update there. Let me turn next to, let's go just work our way from east to west across the state, and we'll look at the model with Healthy Families America. Jennifer, as soon as I can find your screen here, I'm going to spotlight you and love to know from your perspective, thinking through enrollment and retention issues, how specifically have you handled that through Healthy Families America?
Yeah. Good morning, everyone, or afternoon now. Are we at noon?
Central Standard Time.
Good afternoon,
That's
lunchtime. Right. I am going to begin by echoing a lot of what Christel said. These models tend to have, we're all sort of working at similar outcomes. We face similar challenges if we're in rural or more urban communities in our state. So a lot of the wonderful things that Christel shared, we also have done, continue to do, realize it doesn't work, try something else, right? We're always being innovative. I mean, I've tried to delete stay at home from my brain, but it got me to thinking, it put me in a perspective, I think, in all our teams and probably all of us, that we have to continuously be innovative and meet families where they are. And it's not only about the landscape, like not having to, do virtual visits or send kids home to families, but also what is happening. Are folks transient? What are some of the issues? So we have to stay connected with those partners and continue to always offer our services and recruit. So Jonathan, exactly what you said. I think that we have through this model really focused on three major things in the past few years from lessons learned. The first is definitely the marketing and the communications piece, which is tricky because when you do get social workers or parent and child educators, you're also asking them to sell our service. And this is not a skill set that folks expect to have or maybe naturally have. So we have a responsibility as an organization to always be building those skills and also giving them the things and the materials and the existing community partnerships that they need to be successful. But we also need to bring families to us as well. So doing that through sometimes direct mailers, but it's more about taking things to partners, dropping them off, hosting events in the community, partnering with other services and resources that we would normally connect families with so that we're there and we're visible, has been a huge focus of ours. What are we talking about in terms of our programs? How are we talking about our programs? Are we actually showing the value And also, like Christel said, are we actively seeking out sort of feedback and information from families that we serve on how we are doing, and using that to constantly do process improvements? So definitely CQI, definitely parent engagement. So we try to recruit parents, or maybe not that are in our programs, but are adjacent to our programs, to also do some peer mentorship to show the value of these types of things that they've been through the program, because there is no better testimonial for what our programs do and how successful they can be than other families, because we are practitioners in some ways. And so, getting families that have been through our programs to talk about those things is definitely the most successful of all of our recruitment tools. So the second is definitely building all that infrastructure through not only what we call our parent leadership program, but also through calling families that have been in our programs, like, they can stay up to 5 years. So maybe at like the 2-year mark, and saying, would you like to engage in other ways? Would you like to join support groups? Would you like to, how can we help you elevate your voice? Because that self-sufficiency really is what our programs are about. At the end of the day, it is being self-sufficient, because we are not always going to be around. So that has been really successful. And we have actually recently, in the past 6 months, added 2 staff people specifically to build that kind of advocacy and kind of grassroots to grass tops piece. And the last is really just our systems and policies. And are we able to, depending on where we are we able to reach all families and not just some families? So I know for us, especially in Middle Tennessee and Davidson County, over 50% of the families that we serve are non-English speaking. So our communities look very, very diverse. And that is challenging, but also wonderful, because we are helping to meet these populations sometimes that we cannot. And what we find is, because there are not, unfortunately, other services often available, those retention rates with those families and their ability to bring other families into our programs and benefit from those services or the services of our partners are very high. So looking at hiring staff that look like the communities they serve, are native speakers of the language, and investing a significant percentage of our direct services budget to be able to provide the best level of service that we can with what we have to those families really has made a significant difference, especially in our Middle Tennessee area. There's not really a way in 5 minutes to talk about the distinct differences between these things in like rural communities versus more urban communities. And we would have to spend 2 days at a workshop talking about that. So these things look different, but that's why we have a panel of folks from all around to talk about those things. But that's kind of everything in a nutshell. And it's always something we are going to have to look at. It's always something we're going to have to improve. And it's really nice to be in situations like this where we can brainstorm and learn from each other as partners. And so we're always open to those discussions. Thanks.
I really appreciate kind of the highlighting of the, dual language learners and folks that are, families that are outside of this in the rural setting. Yes, absolutely. To dive into this fully, like you said, we could host a whole 2-day webinar and or a whole 2-day conference and dive in really deeply. I appreciate you boiling that down as succinctly as possible. Very, very helpful. Let's turn next to West Tennessee. We'll keep working our way across the state and look at Becky Carroll. I'm going to bring her in here and talk to her from the point of view of Nurse Family Partnership and the work that they've been doing there with LeBonner. And really want to just kind of dive in and ask Becky, from your perspective, as you're looking at this enrollment and retention, I know you've been doing this for a while. What is it from your perspective that you're focused on to really drive up retention and enrollment rates?
Well, first of all, thank you so much, Jonathan, for the opportunity for me to join you all today. I'm really excited to talk about this, and good afternoon, everyone. So we had the opportunity at Nurse Family Partnership at Le Bonheur to grow to a second team, and this was during the pandemic. So we were very excited about this, but as you can imagine, as we've already heard in this call today, it was a different world. There were things that were different, how you can go out and recruit clients, how you can go in and continue to strengthen your relationships with community referral partners. It was just different. And so we did a good job building our new team and going out there, but we wanted to be innovative and creative and see what could we do to further elevate the way that we are in engaging clients and improving our enrollment and retention. And so we got together and decided we created a new position, which we are so excited that we created. It just started a year ago. We implemented the position of a community home visitation program educator, who for short, we call her our NFP ambassador. And just as Jennifer mentioned just a moment ago, who best can talk about a program but someone who's been through the program. So when we designed this position, we very purposefully designed the position to be someone who has been through and graduated through our Nurse Family Partnership program. And so we are so fortunate to have been able to add this position to our team. She's been with us for a year now, and she is amazing. We have seen our enrollment greatly increase in the last year, as well our retention. She's done such a fabulous job. And what we've done is we've been able to take that and with our NFP leadership, sitting down, do a whole CQI process of everything that we've been doing from the moment we get a new referral in. How do we go about that? How do we change it? Who's going to reach out to the client? It's one consistent voice. They always hear from her first. She can share from them that perspective. You know, so many people are worried about that first visit or what the program is going to be like. She can share it. Look, I felt the same way you did when you first heard about this program. So she's the voice. We've changed a lot of other things with our how we schedule that first appointment, and it has really worked. The other great thing, because the other biggest focus with her position not only is client recruitment, but it's also outreach in the community. And so we were doing outreach. We've been around for a while, but she has, by having this position, she's been able to do a lot more outreach, continue to strengthen those relationships that we've already had in the community, and also gain more community partners, which we've just seen our program, as well as our community advisory board, grow even stronger through this. And so we are very appreciative of that. It really has just made such a difference. Some other things that we've been doing as far as client enrollment and retention to improve that. One thing that we've seen is that the flexibility is really important. I think I've heard that also, Christel, you mentioned that, but it's really important to do that because we need to meet the clients where they are, and both physically and emotionally where they are. And so one way that we've done this, of course, as you mentioned, Jonathan, everything's COVID. We're on Zoom now. So of course we switched first completely to telehealth. Now, as we're going back into more and more home visits, we are doing mostly home visits now, but we also are still continuing to do some telehealth visits because that actually works for some people. We do want to get in the home. We've seen that is great, but also for some clients, it's a way to reach them when we need to. We also have the ability to meet them at other locations other than just their home, even it's a home visitation program. But what we really have also seen is that the flexibility that our staff has with their hours helps meet the needs of our clients too, because our staff, most of our staff chooses to work a 4-day schedule, which means they actually work longer hours, which enables them to be able to meet their clients earlier in the day or later in the day if needed, to work around their work schedules as well. And so that has worked very well. But what it really boils down to is that relationship. That is what it is. And being in the home, you can still develop that relationship even deeper than through telehealth. And so having that ability to be in the home or meet the clients where they need to do is really what deepens that relationship and contributes to that retention. One other thing that we have seen through the years is that if a nurse leaves the program, often the clients leave, again, because of that great relationship. So we've really worked hard to see what can we do to really keep the clients, even if they are leaving, or maybe they go on leave of absence. And so we've really worked harder and harder to make sure that they can do a joint visit, at least whenever possible, unless there's something unexpected occurring, where they have the opportunity, the clients have the opportunity to meet the new nurse together with the nurse who's going on leave or leaving, so that they feel even more seamless with that transition. And so we've seen that effective for our retention. And then we also do an annual client satisfaction survey, because we always want to learn from our clients what we can do better and what's working the best. And that has really been great. We've been doing that for a while, and that's been successful also. But I would say one of the key biggest things has been the creation of that position. And we have seen that along with everything else that she works on, which are like client events and things like that, which really brings it together. So our clients see we're a whole village behind supporting them. It's not only just the one nurse that's coming to their home. So I think they feel very well supported.
I think it's amazing and so on brand for, you know, all of our evidence-based home visiting people to highlight the word relationship, right? I mean, how critical is that to everything? Seeing all the panelists nodding their heads. Becky, this has been really helpful. And I think the thing I like that you have highlighted here for us is really saying that, hey, look, sometimes this takes building up the infrastructure to make this work, and hiring that position was a critical piece for you all. And I appreciate you sharing your story with that. So thank you so much.
Thank you.
What I'm going to do now is kind of turn from the specific models that we've got and focus in on a newer project, I should say, that has been happening recently with Tennessee Early Connect. And I'm going to bring Sandra Allen in. Sandra, I don't even think I really need to introduce her or kind of bring her back in. She, to me, is like the godmother of like evidence-based home visiting. She's been the one that I learn almost the most from. I'm always learning new things from Sandra. She would hate me saying this, and I'm sure I'm going to get in trouble later on for that. But here's Sandra. Can you tell us a little bit about what the Tennessee Early Connect is and kind of what's going on in this world that you're involved in now?
Well, thanks, Jonathan, and thanks for not calling me the grandmother of
No, like a fairy godmother. This is a fun thing.
Yeah. So I appreciate it, and I appreciate the opportunity to talk about this. I think a few of you, or some of you, may have heard about Tennessee Early Connect, and it's really a new project funded by MACV Innovation Grant, and Tennessee was one of 8 grants selected in the country, and that grant, it went to the Tennessee Department of Health. And we've been working on getting started on this grant, and I'm happy to say that we are started and that we have our team in place now. We have representatives on the team from the Tennessee Department of Health, from Consistency Group, and from the Early Success Coalition. We also have team members that are from the Urban Institute, which is out of Washington, D.C. It's a research institute that's going to be doing our evaluation and analyzing some of the data for us. So we are really excited that we've gotten started. And I'm going to read, which I think is the wrong thing to do usually, but I want to read what we stated as the purpose of this grant and this project. The purpose of the Tennessee Early Connect is to improve access and enrollment in the MACV funded home visitation and related supportive services for pregnant people with complex social and health related needs in Tennessee. So that's really what we've been talking about today, is how do we increase the access and enrollment of the families that really need the services of evidence-based programs, and also help them connect with other kinds of resource in the community. So I want to start with telling you some of the premises that sort of informed the project and the development of the project. And these premises, I think that you know and you'll relate to and agree with. And the first one is that the earlier families can enroll in the program, the better the success. You know, we're going to have better birth outcome. We're going to have stronger engagement. Families going to feel more supported. We're going to understand that family better. and help them through a number of processes. So the earlier, the better. Also, identifying and enrolling families during pregnancy has been difficult. Right now, we can look at the data and see that less than 1/4 of the families have enrolled during pregnancy. So all of the programs would like to have the families during pregnancy. We think we can have a bigger impact if that happens. So we've been hearing some wonderful things about all the things that the programs have been doing at the level of the program, trying to engage families, some very creative, thoughtful things that they're doing. But now I want to tell you about a system approach that we're going to use. We know that there are several state agencies that interact with the same families that we do. These are the same families. So how can we connect those families and those state agencies together? We know that they have collected data and that they have processes for enrolling clients into their programs. For instance, TennCare or TANF funding and that sort of thing. So we know that there are processes by which they are identifying families and enrolling them. So what this project is about is, let's find out what they are. Let's see if we can connect with them and use them to identify those families that would best be served in evidence-based programs also. So Department of Health, Department of Human Services, and TennCare have agreed to partner with us on this. So we're going to be examining data collection and processes across those agencies to see how we can use so that the enrollment, we have a systematic, automatic way of identifying families that can be referred over to home visitation programs. Jonathan, I'm going to stop there unless you want me to go on. I think that's
fantastic. That's a great overview, and I do appreciate that. Kind of what this is. It's really just touches the tip of the iceberg for what is going on with TEC, and there's some fantastic work going on. I'm assuming that some of the folks here connected here know this and are going to continue to find out if they need to learn more about this. What I want to do now is kind of jump back out to the whole panel. We've got two folks that are just going to give a brief kind of touch on some training that's going on and then a warm line that's happening. And then while they're talking, what I want to do is I'm going to drop a few links in the chat. The first thing that I want to do is kind of point, Becky, if you have the ability, there's a couple of questions in the Q&A. If you want to answer those live or type those in, that'd be great. But let me turn over to Sarah Beth. Sarah Beth, tell us a little bit about the training that's kind of covers the overlap. It's a collective impact approach with evidence-based home visiting and CHANT. Tell us a little bit about that.
Sure. We'll just spend a minute, but yes. So starting next month, we will be providing a training series for the EBHV and CHANT programs. It's about health equity, improving outcomes. There will be 4 training sessions as part of that series. The first round will be aimed at supervisors, the second round aimed towards frontline staff. And it'll really focus on the whole series as a whole, identifying and addressing population disparity in the alignment work of these programs, and equipping participants on how to address it. So we'll review what is health equity, how can we use data to identify disparities. Once we identify those disparities, how do we then address them? So right now we're working with the Tennessee Department of Health to identify participants, and maybe some of you will be part of it.
Super helpful. This is exciting to see this project because there's a lot of overlap, obviously, in the space and the age here, and love to see how that will work out. Kristen, if we can turn to you now, I think we've got you in, but you're looking sideways on my end. Here we go. Tell us a little bit about the work that you guys have been doing to establish a warm line. Tell us what it is, when it's going to roll out, and how that will help us out.
Absolutely, and I apologize. We are blank. Am I muted? You guys hear me okay? Okay.
We're good. We can hear you.
We're in blank. Okay, I'm in Blount County, and for some reason my connection is a little wonky, so I sincerely apologize. But we are at rural counties this week, spreading the word about infant early childhood mental health. So pleasure to be here with the home visiting world today, one of my favorite sectors to connect with. And we are excited to share a project that AIM has been working on in partnership with Allied Behavioral Health and Forwardly/Early Success Coalition. And that is developing the foundation and framework for a warm line for our home visitors that are out in the field. We recently just wrapped up interest sessions where we had home visitors to come and share their information or share what a warm line of mental health consultation look like for them, what they are interested, what would be beneficial to their work and helpful while they're working and supporting families in their homes and in their communities. And so we hope this warm line will be a direct connection for home visitors in the field to connect with a mental health clinician professional when there are things that come up when they're working with families that are specific to mental health issues and challenges and things that our families are facing every day, and how can we connect them to resources within their community. So this will be a number that all home visitors will have access to. Again, it will have direct connection to a mental health clinician professional. We call it a warm line because it will be during regular business hours. So, if you did call later in the day, that someone would call you back pretty quickly after that. We are hoping, our goal right now is to roll it out in May and have kind of a pilot project with that, and then hopefully to spread it to all home visiting agencies in Tennessee. And then, John, if there are questions in the chat, would you mind reading those to me?
Absolutely. Yeah. So we've got a couple questions in the chat. They've been, I think, mostly focused specifically for Nurse Family Partnership, but I think she's answered those, typing those out. So good to go there. I wanted to say real quick before we leave, there's a couple of notes in the chat for those of you that are attending this as our first one. We always want to make this better. And so please take 60 seconds. I timed it. It takes less than that. Fill out the survey. Let us know how we've done. Also, let us know what you're interested in talking about problems of practice as we kind of move forward in this in the future. The second link that I dropped in the chat with everybody is specifically a link to go ahead and register for the March Lunch and Learn. We've got this scheduled out for the next one. We're going to look at high dosage, low ratio tutoring. So for several of you that there's a crossover and you're interested in that as well. Others that may not have joined this, make sure that you register for that coming up in March. March 24th is going to be our next one. So again, we'll do these on the 4th Friday of every month as we move forward, and we'll cover things that are pertinent and applicable to you. I am not seeing any other questions in the chat, and say we're right at time. So let me stop and just pause and thank our panelists. Thank you all for the work that you're doing in the state on behalf of children and families. Appreciate the hard work that you're doing. This has been an exceptional time over the past 3 years, kind of doing this work and finding ways to be flexible, making sure that whatever it is, it's always about these relationships, right? It's always about kind of pulling things back together and making sure that families are supported through relationships. Appreciate each of you, your time here, and we'll end it that way. Thank you so much. Bye, everybody.